Hi, this is Raul for Amaze magazine, and today we have the extraordinary honor and pleasure of chatting with author Dr. David Wilcox, who is the author of How to Avoid Being a Victim of the American Healthcare System, a Patient's Handbook for Survival. David, so good to have you with us today. I'm very excited about this book. I think people would like to know a little bit about you, kind of your qualifications. Tell us a little bit about yourself.
Sure. So I am a doctorate prepared nurse. And why that's important is because, a doctor will come in and diagnose you in 5 minutes and then turn you over to us. And then we get the pleasure of taking care of you and your family through some of your healthcare crises. The fact that I'm a doctorate prepared nurse, which was an ongoing journey over my years in my career, is because I left home as a high school dropout and then went back to school and started getting my degrees. So I did everything from being a licensed practical nurse to a registered nurse. I got my BSN, I got my master's in healthcare administration, picked up a Lean Six Sigma black belt, which is basically efficiency along the way, got certified in board informatics, in nursing informatics, and then got my doctorate. So when I got done with the doctorate, I thought, what is the best way for me to share what I've seen over my almost 30 years in healthcare with people, and actually a lot of people, not just like a group or two. And so I decided to write this book after doing some research and seeing that nobody had this information out there. So it's basically, when you enter the healthcare system, it's a whole different world. I mean, it's based in Latin, there's abbreviations, you're going to get a CT, you're going to get an EKG. The average layperson doesn't know what they're talking about. And so I thought it would be appropriate, especially now given the staffing shortages, that people are proactively prepared to go into the hospital, or they get their insurance claim denial letter, they know what to do, or when they go to the pharmacy and find out their prescription was jacked up and they don't have the money, they're deciding between whether they're going to eat or whether they're going to take their medicine. And that happens quite a bit in America. So I thought I would put pen to paper and start to talk about those things that were important. So my qualifications are I'm a healthcare disruptor. I'm going to tell you some things the insurance companies don't want you to know. I'm going to tell you some things the pharmaceutical companies don't want you to know, and things that the hospital bean counters don't want you to know. Now, preface that by the fact that the nurses and the doctors really got into this profession to care for people, and they're just as frustrated by the American healthcare system as the patients are, because it's very profit driven.
A big part of my background is in healthcare as well. I practiced dentistry for 30 years, and so I've come up through the educational system, and I've done hospital rotations. I was getting IV certified. I've got Navy background, all that kind of stuff too. So a lot of what you were mentioning really rang true to me, as far as, like, for example, knowing more about, like, who is your team, who is your surgeon. I think that the big challenge so many times, especially when you're a lot younger, is that you take it for granted and you have no information because you don't think you're going to go to the hospital necessarily at all. It's an unexpected kind of thing, and you're in there and you're hoping for the kind of the best.
Crossing your fingers and hoping for the best.
And you've not really had a chance to establish a rapport. And I think as time has gone by, definitely we've seen more and more push on providers to see more and more people. And it, I think, really rang true with my parents and my in-laws when you would hear, comments like they would go for a checkup and have too many chief complaints, and the doctor would say, pick one. I only have time to address one of your issues. And it's kind of like, but this is my checkup. I need to tell you about all of the, aren't they relevant? Is kind of, might be important. I want to tell you. So it's been a progression as the system is kind of limping by, and having been in a Navy system where there wasn't really any choice. I mean, you got who you got, and it wasn't costing you anything. You didn't pay anything for your prescriptions.
Right.
But they did police themselves with a level of quality, and where they maybe fell short from an administrative point of view is they were not a very efficient system. So if you looked at, like, if you were billing in that Navy system, you'd probably go bankrupt, because they had the luxury of saying, I will schedule this much this day, and this is all I will do, or whatever. Whereas again, bean counters pressing, going, you have to have these many encounters, you have to have this. We're monitoring, we're incentivizing on production, and it changes the personal contact between the patient and the doctor. And granted, there are some brave souls that continue to try to do the best they can, and again, as you mentioned, they got in this to help people with a pure desire, but they're squeezed between the rock and the hard place. And, it is a real challenge.
Yes, healthcare is 1/5 of the economy. After COVID, we were spending 19.7% of the GDP in healthcare. It's absurd. Other countries that have better quality outcomes than us spend about 8.7% on average. But they spend more on social health care, making sure that they're looking at your zip code to see where you live and making sure you're getting equitable care, whereas we don't in this country. It's a big money-making machine. It's tied like a glioblastoma. You know what that is, right? Around your brain. There's no way they're going to get that out. It's a tumor in your brain. And into the political healthcare system. So politics, 43 million crossed the aisle from just the pharmaceutical companies alone into both sides, both camps, to make sure that they get their return on investment so they stay unregulated. And much of what you said, so this fee-for-service model, we saw it, especially during this pandemic, that if you didn't show up, they didn't make any money, right? So when COVID came out, everybody was like, I'm not leaving the house, most people, until they could figure out what it was. And so we, the taxpayers, had to bail these guys out, right? Because if you don't have people coming, hospitals are going to shut down, especially in rural areas. And so what people don't know is there's a different model than fee-for-service, because fee-for-service, you show up, you get processed. Doctor doesn't want to hear all your complaints like you just said. He wants to center on one and get to the next patient because that's how he makes his money. There is this other model called value-based care, which is administered by accountable care organizations, which is a fancy word for a bunch of doctors and services that get together. They take a certain amount from the insurance company to manage your care, and they have skin in the game. So if you go to the hospital and cost them money, it comes out of their pocket, not necessarily the insurance company, who would just probably deny you anyway, but it comes out of their pocket. So the numbers show that people who are in accountable care organizations or using value-based care are getting better outcomes. They're getting their flu shots more often. They're getting, text, hey, it's time for your colonoscopy, or your mammogram. It's just incredible when people have to have skin in the game, especially medical professionals, what they will do to keep you healthy. There's a funny story in my book about my brother-in-law. So my brother-in-law was getting a hip done, and he was on a value-based care model. So they got a certain amount of money for his hip, and that was it. And so my brother-in-law got his hip surgery. They gave him some really strong narcotics. Now, this guy, I've never seen him drink. I don't think he uses any kind of illicit drugs. So he popped a couple of them when he was in pain, and all of a sudden his heart was beating out of his chest. They rushed him to the emergency room thinking he was having a heart attack. He got a very expensive cardiac workup in the emergency room, and then it turned out that the pain medication was just too strong. So then my sister calls me the next day and she says, well, we took Hal to the emergency room, but there's a nurse out here right now and they're coming out and it's all free. And I said, no, it's not really free. I said, he's under a value-based care model, and he just costs them a whole lot of money by going to the emergency room. I said, so of course they're going to come out and check on him because they don't want you to go back. But that kind of skin in the game changes things, because then they're looking out for you to be healthy. In the fee-for-service, you're a number. The people at the top who are collecting the money, they don't care if you live or die. They just don't. The doctor does, the nurse does, but there's only so much control we have in that kind of a situation. We really need to revamp the healthcare system and start to incentivize people to keep people healthy. Of course, we have to do our part too, not eating processed foods, things like that. We're trying to stay healthy, eating more fruits and vegetables. But there's a model out there that works. It's just only 25% of Americans even know about it.
Absolutely. Well, and part of the problem, the whole picture health, I guess, when you look at all of the possibilities and ways, like nutrition being a very basic one. I remember the aha moment we had when we started reading labels at the supermarket and discovering that sugar was the first ingredient in so many things. And you're kind of going, I didn't know that ranch dressing had 4 tablespoons of sugar per serving or something. And then, oh, what a surprise, the CDC very passively has been watching the obesity epidemic go over the last 30 years. I mean, it is a tangible, mathematically visible trend where at the last time I looked, I believe Colorado is the only state that is not over like a 30% morbidly obese level. And the healthcare system dealing with all of the things that go with it, if it's not a preventative measure, then the pharmaceuticals make money with metformin, insulin, testing kits. I mean, and now you're stuck forever because it's a permanent kind of thing.
Yeah, it's not the root cause. It's a temporary relief. So if you go to your doctors and let's say you have high cholesterol, and your doctor's not going to say to you, well, just don't ingest cholesterol. Your liver makes it naturally anyway. He's not going to say, hey, stay off of meat and dairy. He's going to prescribe you a statin drug. Right. And so I don't know. For me, I went onto a plant-based diet and I had a high cholesterol. And from having it at 240, it's at 135. My LDL's great. I mean, but it's because I'm not eating meat and I'm not eating dairy. And, our culture, people are afraid of that. They're like, well, what are you going to eat? Or that's crazy, But you can make some great plant-based dishes. And then again, there's vegan junk food out there, too, you have to stay away from. So it's...
Well, the catch is like things that have been fried in the wrong kind of oils. It could be a plant-based product, but it was done in canola oil, or it was, one of my favorite snacks when we were kind of doing a keto approach was pork rinds. And you kind of going, yeah, probably not the best choice as far as your healthy snack. Yes, it doesn't have carbs, but still not great. But I think, again, there's so many points with taking a more preventative approach, and in addition to that, considering alternative options as well. Because again, with somebody, let's say you're borderline diabetic, and instead of telling you really need to reassess your diet, you need to do these other things, again, they're pretty prompt to, here's your testing kit, here's your metformin, have a nice day, we'll see you. I remember I was working at one point because of the stress level at my job on an ulcer. And I'd had the classic sudden chest pain in the middle of my chest, but I knew the signs of cardiac issues. And I called my doctor's office. I said, I'm having some chest pain. They're like, go to the emergency room right away.
Yep.
Go to the emergency room, get worked up. They're like, no, you have heartburn. Have a nice day. So go back to my physician. He wants to prescribe me Protonics. And I said, well, how long do I have to take this? And he looks at me and says, oh, forever. And I'm like, well, that's not an acceptable answer to me. Right. So I looked forward and found a naturopath and approaching an approach of diet modification. I had to give up coffee for a while. I had to give up raw onions. I had to make some changes on my end and do some tinctures before eating. But lo and behold, after 6 months, I can eat pretty much anything I want to eat. And I have not taken Protonics except for a short while. And I think so many of us are aware that there's not a single medication that you can take that doesn't have a side effect. And yes. So even the common aspirin or Tylenol, which was, they're going, oh, that's safe, I could take a bunch of it. Well, you've got the liver issues with all of your NSAIDs, you've got gastrointestinal bleeding. I mean, it's all in the fine print that they rattle on the TV commercial that you're supposed to kind of ignore, may cause hair loss, chronic diarrhea, blah, blah, blah. But hey, we think it's a great medication. We think you should take it, and we'll even be happy to start you for free to help you out so that you can get going on it, and then you'll just keep paying for it down the line. So again, I do think the philosophy and the training, because again, it starts from our educational sources.
Right.
So if you're pushing a pharmacological based mode and physicians are taught this is the way to do it. And we used to have the saying, like, for example, if you do a consult with a surgeon, he's always going to want to do surgery. That's what they do. Surgeons cut. And that's how they cure. It says, what's the solution for this? Cold steel and sunshine. We used to say it in dental. You take it out and the tooth problem is gone. But that leaves a new issue. That leaves a whole new problem. And if you do that too many times, now you have no teeth, or you take out, you do too many surgeries, you have complications, and there's not a single thing that they can get away with that you may not have. That's why they now, with your informed consent, which everybody glazes over, because if you're in pain, I'll sign whatever, but even in dental procedures, it says, you could die. Does anybody say, well, then I'm not getting this filling because I don't want to die? They're like, no, I need the filling. My tooth hurts. I'll do what I have to do. So again, I think if we started from the educational beginning as we train physicians to the more holistic point, and then in a preventative mode, if we're looking at it going, let's cover alternative care. Fortunately, I'm in Washington State, and it is kind of a covered benefit. So if you need to see a naturopath, that should be a covered thing. If you need to see an acupuncturist, that is a possibility with certain, and it's effective. As my acupuncturist often told me, we've been doing this for thousands of years before you guys even started. So we know something about some of these things. It's not one single solution, but Western medicine physicians need to be able to say, here are some options, here's some different ways we could go with it. And I think it also, in a preventative mode, it would only make sense to do this kind of thing. So I guess one of the big questions people might want to ask, and part of this will be in your book, is how would we locate an organization that would be more preventative based? Because I think the thing that we all see when we drive along is the big shiny hospital. That's where they've put the money to attract your attention. And they'll talk about the latest technology and lovely facilities and nice grounds. You just don't know how much you're paying to contribute to that whole thing.
That's right. So on a personal note, I had some back problems, and my doctor wanted to give me, ibuprofen and jack me up on muscle relaxers and all that kind of stuff. And I went to a chiropractor, and after about 2 treatments, I didn't have a back problem. Now I still go to maintain, but they don't tell you that. Like, why don't you go to a chiropractor, or, why don't you see a massage therapist? Mm-hmm. That's something that you have to find out yourself. And again, the reason why I wrote this book was because there's so much stuff out there that the surgeon's a great example. So, if you're the first case, statistically, you'll do better. If you're the surgeon's first case in the morning, as long as he hasn't been on call the night before, you'll do better. And nobody ever asks that question, hey, can I be your first case? Because they don't know. It's funny, my neighbor got a copy of the book, and he had to have hernia surgery. And so when he went in to talk to the surgeon, he's like, so are you the guy who's going to be doing the surgery? Because if you're in a teaching hospital, it could be an intern cutting onto their first patient, and you might be that first patient. Mm-hmm. You have the right to say to the surgeon, I want you to do my surgery. Not a lot of people know that occurs. The second thing is, he said, am I going to be your first case? And he said, well, I actually had you on Thursday. And he said, well, can you do it the following week? And can you make me first case? So they made him first case. And plus, you can't eat or drink, so you're miserable all day until go to surgery. So, yeah. I mean, just all these things. And then how do you treat pain? Because I've seen some surgeons who are like, take some Tylenol, and people are just in agony. It's all their preference, right? And then other surgeons who are like, here, take a whole bunch of Percocet, So there's no middle ground there. But so the book kind of gives direction in those kind of areas. It kind of preps you for what you do when you go into a hospital. So having a medication list on you, because the hospitalist isn't talking to the surgeon about your medications. It's in a system. You're hoping they got it right. They're going to give you a bunch of pills. Some of them are going to be what you're used to. Some of them are not going to be what you're used to. So then you want to ask the question, what is this pill? And they'll tell you, well, it's the generic version of what you were taking, low pressure or whatever the pill is. But you have to ask those questions. And then if you run into a situation because hospital staff is stressed where they're not answering the question, don't take them. Yeah. Say, bring me the manager of the unit and she can explain it. Give me somebody who's got some time, because I'm not just going to down these. If you're going to get hurt in a hospital, it's usually centered around medication. So, there's a whole bunch of tips in the book about that, how to best prepare for it. But, it's hard for me as a medical professional because, I know the surgeons to go to, I know the surgeons not to go to. And there's some spots in the book where I talk about that, like meeting a lady in the grocery store who said she was telling a friend of hers, she was going to get a procedure done by this guy that was just terrible. And then I was wrestling with my conscience. I'm like, should I say something? Which would have been totally inappropriate if I was prepping her for surgery, but I'm in the grocery store.
Yeah.
And so when she came down, I said, hey, you really need to, I can't tell you who I am, but you really need to get a different doctor. I work at the hospital, and and that's all I can say. And she was like, okay, thank you. And then when I saw her come in the hospital, she was under the care of a different doctor. But people don't know that. So I've created a resource guide so that you can actually rate your doctor. You can go and find cheaper pharmaceutical prescriptions, and you can price out your procedure, which is something the hospitals were supposed to do. That there was legislation passed on it, and there's fines, which nobody's collected on. Only about 15% of the hospitals are compliant because they don't want you to know what it's going to cost. If you're going to get a total knee done at a hospital, it's going to cost you, in my area, it's going to cost you about $12,000. If you go to an ambulatory surgical center, and by the way, they usually have better outcomes, it's going to cost you $8,000. So if you're paying high deductibles, that's the kind of information you need around healthcare. So I put together this resource guide anyway. So it's one click to see the hospital's star ratings, to see if the hospital's got great quality outcomes, if the patients are happy and satisfied. Star ratings on the CMS website are 1 to 5, 5 being the best, 1 being the worst. And getting your information on procedures and being able to find medications. And if you go to drdavidhelps.com and you sign up for my periodic newsletters, you will get the resource guide as a free gift. And it's one click. You can load it up. It's on a PDF. You can load it up and click, and in you go. You don't have to guess around the sites or anything like that.
Nice. I do think the book, it's the kind of book that if you have, let's say you're a husband and wife, both of you need to read it, because one of you will be a little incapacitated with whatever the situation is, and the other one has to take over this part of it. I think that was kind of the challenge, because I know my gallbladder gave out, and my wife was very instrumental at making some cognizant decisions, because especially after the pain medications, I was like, and I've told her, I said, I met the surgeons, I met the team, I don't really remember an awful lot of much. And it was one of these, this needs to happen, it needs to happen today. And I would have wished I could have had the benefit of being the first surgery of the day, but since it happened when it happened, it's like, this just needs to get done, and I'm keeping my fingers crossed. And I was even ambulanced to a different facility, and part of it is because I am in one of those systems that focuses more on preventative care. So one way they control their costs is they have their facilities. And so they outsource emergency care because they can't have places everywhere, but the moment they knew I needed surgery, they're like, nope, get him in an ambulance, bring him to our hospital, to our people. We need to do this. We need to manage it. But this valuable information should be in the hands of anybody in the family. If if you have your kids are looking after you, they should read it so that they can know a little bit about what they might need to do. And even in instructions, having your DNR in order, knowing what that means, what all the details. I mean, my gosh, again, so many times the health team is just trying to do their best, and it's a frenetic moment, and you're not in a great place to decide either way.
Yeah,
So,
and you bring up a good point about DNR. So I have seen in the hospital system where somebody had their wishes spelled out, and the family decided to change them, and they ended up with a breathing tube in place, being fed by a stomach tube, and off they go to a nursing home. And that's a miserable way to go. So having conversations with whoever's making those decisions, I cover that in the book, where I kind of dropped the ball with my mother because I went into son mode at the last minute, but thank God, there was a different path for her. But, they have to know, because if not, they say, well, I don't want to lose this person. I don't want to lose this person. And that could cost you 18 miserable months before you die in a nursing home somewhere, waiting for your family to come visit. So it really is important, because everybody is going to need health care at some point. You can't get out of here without getting health care at some point.
absolutely.
So yeah, it's really important that you have that in order.
Totally. Well, David, we appreciate you taking the time to share your knowledge with us with this book. This is something that we're going to keep close to us. And again, I've read it first. My wife will be reading it next. Folks, make sure you check out How to Avoid Being a Victim of the American Healthcare System. Go to drdavidhelps.com and sign up. And no matter your age, no matter where you are, it is time. As much as I'm hoping, and I think we all do have positive hopes for healthcare reform in this country down the road, you need to look out for yourself, at least for the time being. So,
yes.
So this is a very useful tool. So thanks again. You've seen him here, Dr. David Wilcox, Amaze Magazine.
And you can get the book up on Amazon. Just FYI, you can get the book on Amazon.
Excellent. Thank you, David.
Thank you. It was great talking with you. Have a great day.
You too.